If you want to make the right choices about your Medicare health insurance plans, you've got to understand how Medicare A and B work, what we call original Medicare. I'm going to explain it here for you. Subsequent videos, you have to understand how Medicare Advantage works, how Medicare supplements work, and how drug plans, Part D plans work. So this will be a very valuable video for you. I'm going to go through this quickly so you don't feel like you're wasting any of your time. Part A of Medicare, if you're eligible for Social Security, there's no premium for it. Essentially, it covers inpatient hospital and inpatient skilled nursing care like rehabilitation. If you go into the hospital for 1 day or 7 days, as long as it's less than 60 days, Medicare will pay everything except for the Part A deductible, which in 2026 is $1,736. That's right, 1 day, 60 days, 7 days, 10 days, it doesn't matter, as long as it's less than 60 days. If you come out of the hospital for 60 days and you go back in, you'll probably pay that again. It could happen several times within the year. In rare cases, somebody stays in the hospital more than 60 days. If you stay between day 61 and day 90, it changes. Your responsibility goes to $434 per day for those 30 days. That's over $12,000. That's why you talk to somebody like me who understands and helps you transfer the risk. If you stay in the hospital more than 90 days, again, incredibly rare, I have seen it, you use what Medicare calls the lifetime reserve days. Days 91 through 150, you can only use once in your lifetime. You don't have to use them all sequentially. You can use 10 of them here, 10 of them there. If you're using those days in 2026, your daily copay goes to $868 per day. Medicare pays the rest. Beyond 150 days in the hospital, Medicare is done paying. It's on you. Hopefully you have an insurance company picking that up. Generally speaking, they don't keep you in the hospital long once they stabilize you. If you still cannot go home, even if you have a wife or somebody at home, kids who can help, many times they'll put you into inpatient rehabilitation known as skilled care or skilled nursing care. The first 20 days of an eligible stay, Medicare pays everything, so there's no copay, there's no cost sharing, there's no co-insurance. From days 21 to days 100, which is the max, the copay goes to $217 per day. Medicare pays the rest. That's it. 100 days, more than 100 days, they consider that long-term care usually, and you're on the hook for that. But that is how Medicare A works. My name is Aaron Beaudet, and with my son Travis, we run MedicarePrepare.com. We have over 40 years of experience between the two of us. We help people find the plan appropriate for them, whether it's Medicare Health Plan, Medicare Advantage, Medicare Supplement, drug plans, long-term care, life insurance, what have you. So reach out to us if you can help. Here's our names, here's our numbers, here's what we look like. Get that? I know I went through it quickly because people want to watch short-form video. Part B, how much does it cost? For the average income earner in 2026, the premium is $202.90 a month. Typically, they take it out of your Social Security check. If you're not collecting Social Security, they'll send you a bill, usually quarterly. You can rearrange that. What does Part B cover? Part B covers a host of services. It's doctors, it's specialists, it's outpatient procedures, it's preventative care, it's testing, outpatient therapy, whether occupational or physical. Some medications that are administered in the hospital or a doctor's office can be covered under Part B. I'm going to flash up here some of the other services. Medicare Part B has an annual deductible in 2026 of $283. Yes, that deductible must be satisfied prior to Part B commencing payments for anything. Once that deductible is satisfied, Medicare Part B pays 80% of what they approve. The 20% is the responsibility of the patient. It's 80-20. Again, I'm here to help you understand how it works so you know how you can properly transfer that risk onto an insurance company. That's what most people will do. In a subsequent video forthcoming, I am going to talk more about the Part B premiums. If you are a low income earner, you probably don't have to pay the premiums. You'll qualify for a Medicare savings plan or even Medicaid, which I'll talk about in a future video. If you're a high income earner, you will probably be hit with the IRMA, the income related monthly adjustment amount, and pay an enhanced premium for both Part B and Part D. I'm going to flash the 2026 chart here just so you can see what you may be facing. This video was helpful. You can watch it again and again or stop and freeze frame things. Again, Aaron Beaudet, Travis Beaudet, Medicare Prepare. Reach out if we can help.